Hi, my name is Alana Kapelak, and this is my response to the discussion question, excuse me. And that question is, what is the difference between the roles of the state and local health departments in providing public health services? The first thing to consider is the Department of Health and Human Services. They, as we know, are a cabinet level agency within the executive branch of the federal government. In many ways, they provide health and human services to all Americans through the state and local public health agencies. Personally, I think funding is the most important way the Department of Health and Human Services connects with state and local health departments. When receiving funds from the DHHS, state public health departments are required to use the funds in ways the DHHS directs, as well as following the standards and policies set by them. With additional funding from the federal government, the state public health departments can now create public health initiatives that reflect the state's population. The state sets the public health policies and standards for that state, facilitating a model for the local health departments to follow that is tailored explicitly to the local population. The local health department is then tasked with developing ways to deliver the standards the state sets to their local community. Implementation can look different from one local community to another, as long as the state and federal government's standards are achieved and policies are followed. I have an example of the difference between the roles of the state and local health departments. The local health departments report instances of disease and outbreaks of all kinds to their state departments of health, say for cases of HIV, measles, influenza, etc. The State Department of Health then notices a sudden spike in measles cases, let's say. So then the State Department of Health may then choose to mandate a statewide vaccination program for specific high risk individuals. The local public health departments are then responsible for ensuring their community has received the required vaccinations as set forth by the state. Now, how they do that can look different from local health department to health department, but essentially they are to follow the guidelines of the state. Um, and that's it. Thanks, guys. Sorry to end it a little early.